Quality healthcare is an essential service that governments strive to provide for citizens globally. But service delivery without proper regulation is dangerous. Hence, establishment of the Health Facilities Monitoring and Accreditation Agency, HEFAMAA, by the Lagos State government. Established in March 2006, the agency is saddled with the responsibility of monitoring private and public health facilities to ensure registration and accreditation of such centers in Lagos. This week, our focus is on the agency and the Executive Secretary, Dr. Abiola Idowu, who will be our guide on this journey. Welcome to Inside Lagos. I'm Adedoja. Salam Adeniyi. Health, they say, is wealth, since only healthy citizenry can make meaningful contributions to societal and national development. For a hustling and bustling megacity like Lagos, healthy and vibrant citizens are critical to its socio-economic growth. Hence, the administration of Governor Babajide Sanwo-Olu accords health a pride of place in its development agenda for Lagos State. In the policy thrust of his administration, themes, health and environment constitutes the second pillar under Governor Babajide Sanwo-Olu's
It's a
health
gathering
agenda.
of different church leaders who are members of Christian Association of Nigeria and top
boost access to quality health care for residents.
Prayers were offered for the
this
country,
government is driven
the unity of the body of Christ, and the coming general election. Addressing the gathering, the national president said his tenure will be that of unification and also one that will put the interest of the country first. Speaking on the 2023 general election and campaign, he advised politicians not to divide the country, but run issue-based campaign. The reception was organized by the Organization of African Instituted Churches, 523. The reception was organized by the Organization of African Instituted Churches, IV.
This hospital will provide a secondary integrated care service and an acute care to both inpatient and outpatient in line with international best practices.
The Sanwo-Olu administration also embarked on comprehensive renovation of public health facilities like that of Ebute Metta and Harvey Road Health Center, the Infectious Disease Center, Yaba, and some general hospitals, among others. But there can be no effective service delivery without proper monitoring and regulation of these facilities and healthcare providers. The Health Facilities Monitoring and Accreditation Agency, HEFAMAA, was established in March 2006, is empowered by law to carry out this responsibility. Since its establishment in 2006, the Health Facilities Monitoring and Accreditation Agency, HEFAMAA, has continued to monitor and regulate private and public health facilities in the state. The agency embarked on constant monitoring and inspection of health centers to ensure that they are properly registered and accredited to deliver quality services to residents of Lagos. According to the Executive Secretary, Abiola Idowu, the agency also employs advocacy and enlightenment campaigns to ensure healthcare providers adhere strictly to regulations. In this regard, the agency staged a symposium with the theme, Medication Without Harm, to mark
the 2022 World Patient Safety Day. At the event, experts stressed that unsafe medication and medical errors are leading causes of avoidable damages in healthcare service delivery across the world. Annually, an estimated 10 million patients suffer avoidable medical harm, leading to serious injuries or deaths worldwide due to unsafe medical practices and poor quality of care. This is according to the World Health Organization. This gathering of healthcare professionals in Lagos, southwest Nigeria, is all about safety of patients. Diagnostic errors, unsafe injection practices, unsafe transfusion practices, unsafe surgical care procedures are leading causes of permanent disabilities or deaths in Nigeria. These can be avoided.
The consequence for the children, because they are pediatric nurses, we are that 46% of the children went into shock. 42% of the children, due to this medication error, were restless, and 22% were disoriented as a result of the medication error, while 20% suffered respiratory depression. So it's very important that monitoring is intensified in our health facilities.
Medication safety is critical to public health. Hence, the need to create more awareness and take appropriate action to address growing challenge of medication without harm.
The function of Ministry of Health through our regulatory agency, HEFAMAA, is to make sure that these facilities are up to standard, they have the right equipment, they have the right personnel, the personnel have the right qualifications, and that there is continuous monitoring of these facilities several times a year to make sure that the standard does not drop. In the process of administering treatment, the treatment can take the form of drugs, it can take the form of advice, it can take the form of vaccination, it can take the form of an intervention, like a surgical procedure. Now, all of these interventions are under the jurisdiction of the caregiver, and the caregiver is responsible ultimately for the outcome of that treatment with the patient. So if I'm treating you for a condition, I'm hoping that that medication is going to resolve that sickness. But in the process of resolving that sickness, sometimes we will see minor or moderate or major side effects. So as a caregiver, you have to weigh up the difference between curing a condition and the side effects that your treatment is going to confer on the process of trying to heal somebody from a condition.
We want patients to have confidence that when they access health facilities in Lagos, that they are getting the best that they can get. So we go on monitoring and inspection of these health facilities to measure their compliance against the set standards.
In May 2019, during the 72nd World Health Assembly, the WHO adopted a resolution for global action on patient safety and declared 17th of September every year as World Patient Safety Day.
This is the Office of the Health Facilities Monitoring and Accreditation Agency, HEFAMAA, in Lagos, here in the Ikeja area of the state. But we are here to actually interact with the Executive Secretary, Dr. Abiola Idowu, on how the agency is delivering on the mandate of ensuring standard health facilities here in Lagos. Please come with me. Yeah. HEFAMAA is on the 3rd floor, so I have a lot of exercise to do here. Yeah. Good morning, ma.
Good morning, madam. Good morning. How are you today?
I'm fine. My name is Adedoja. Salam Adini.
Okay,
with TBC News.
Okay, I'm Dr. Abiola Idowu,
Yes,
the Executive Secretary of HEFAMAA. Please sit down.
Thank you so much, ma. Good morning, sir.
Good morning again. This is Dr. Iboma. He's a director in the agency.
Good morning, sir. Okay. So we're actually here to know how HEFAMAA works. That's why we are here.
Okay, so
we are on a monitoring visit, I believe. So where exactly are we going?
Okay, so we have chosen a facility that is not too far from here. Okay. Yeah, it's called Sky Eye. So we're going to pay them an unannounced visit because according to the health sector reform law, we have the power to visit any health facility between the hours of 8 a.m. and 5 p.m.
So, shall we?
Yes, please. Thank you.
That's fine. After the interaction in our office, Inside Lagos crew joined the team on an inspection tour of some health facilities in the state.
Quite busy. Coordinates the activities of the agency. Right, thank you.
The trip took us from the agency's office in Ikeja to Magodo, where officials came to inspect the facilities and quality of service being rendered at a private hospital, Sky High Medical Center.
Okay, madam, please, we're going to need to cross over. Yeah. Okay. All right.
Well, as an agency saddled with the responsibility of accrediting, inspecting, licensing health facilities, HEFAMAA has beamed its searchlight on medical centers to ensure delivery of quality services like this facility here in Magodo area of the state. But how does the agency interface with owners of such facilities to ensure adherence to standard and quality service?
We do that by monitoring, but the first thing we do before monitoring is inspection. The facility gives us light, like an intention, writing to the Honorable Commissioner of Health that they intend to establish a facility. Once they do that, we have an app called HEFAMAA. They register on that app and then we come for inspection.
The medical staff at the hospital were on ground to receive that team.
And that's our recorder. We come out as a team to inspect for compliance to the set standards of the agency. Once we're sure that they meet all the requirements, we give them a certificate of registration. Once we give them that certificate of registration, we give them the logo and let the public know that you are a registered facility. And then also, when they are registered, they're supposed to paste their certificate of registration that we give them as an agency. It's the law, so that anybody who comes in knows that the facility is registered with the agency. So once they are registered, we now need to visit that facility at least twice in a year. We have various categories of facilities under us. We have hospitals, we have clinics, we have laboratories, we have maternity centers, nursing homes, we have radiotherapy units, we have diagnostic centers, we have home care based, we have missionary facilities, we have a whole lot of them, but the pharmaceutical outlets are not under us.
Okay, and what happens if they default?
Okay, so it depends on the type of default. So if a facility defaults, for example, in the area of human resource, we come here, we don't find doctors and nurses who are licensed to practice in Nigeria, then we do not consider that a health facility at all. It's just a space. So what we do is shut the facility down. But so, for example, we have very minor infractions like waste management. We write a notice of non-compliance. And then after we have written the notice of non-compliance, we revisit, but we sanction as well. From our database, they offer like pediatrics, maternity services, yeah, then general medicine, yeah, yes, and okay, they also have a lab. So we would go to every service area in the facility. We would also look at their records.
The facility inspected at the hospital included the dispensary room, manned by a technician, the laboratory, which offers in-house services to patients, 3 hospital wards, A, B, and C, and the labor room, equipped with an ultrasound machine for pregnant women.
We want to see if the consulting room is adequate. Oh, okay, all right. Good morning. We're from HEFAMAA. Sorry to disturb you. Yes, okay. So the place is adequate.
Satisfied with this?
We're satisfied because they also need to have
bins showing that they are disposing of their medical waste appropriately and that they are segregating it, and it's obvious that they are doing that. Yes. Oh, okay. So yeah, the space must be adequate, and then the general cleanliness, the chairs, yes, something, sitting arrangement for the patients, and then also we check for like confidentiality, the fact that the patient can come in and the patient has enough privacy when the patient is seeing the doctor. Or your treatment room. Okay. Okay, so this is a treatment room. Okay, yes. So, okay. We check the bin and make sure that they are segregating the waste wherever. Okay, Mrs. Skinny, Ewawe emergency. Check their emergency cart. Yeah, you need to, yes. Yeah. Okay. Yeah, go and check the crash cart, please. But this is adequate. Yeah. Your records have been moved to electronic. You need to submit data to local governments on a monthly basis. Can we have evidence that you are doing that? Yes. We need to also quickly check the word. Okay. Okay. So do you have a technician? Okay. We would also need his license. Okay. All right. Mrs. Oluwale, please come and check their records, just so we know that there is FIO, first in, first out, and how they dispose of their drugs. Okay, and the tool. Okay, so please come in. All right. Oh, good morning. Are you a laboratory scientist? Huh? Okay, you are a lab technician, but you have a scientist who covers you. Who comes here? Oh, yeah. Okay, so first and foremost, we're going to need your practicing license and the license of the scientist who is covering you. So what services do you provide in this laboratory? Microbiology? Yes. You do biochemistry? Yeah. What else? Those are the things you do. Okay. All right, okay, and then you do point of care testing.
At the end of the inspection, it was time to sit together with the management of the hospital to compare notes and provide assessments.
We want to say you are doing a good job, the facility is clean, and up to an extent, the waste management is in good shape. Yes, but the one or two things that you need to improve on. So, for example, at your treatment room, some of the your pillow and your whatever, and the couch, you need to Macintosh it. And then, of course, we discussed earlier concerning the pharmacy. You need to practice first in, first out. You need to ensure you have a room temperature. A thermometer to check the room temperature, and you have to do it on a daily basis, at least 3 times a day. Then you have to label your drugs appropriately. For those, your clients who are getting the drugs, for each of them, you must label the expiry date on those envelopes so that they know when the drugs are no longer good, yes, viable for them to use it.
What's your conclusion generally in this visit?
Okay, from this visit, they have scored, they are good, they are okay, yeah. It's a facility that has adequate medical staff, and the general cleanliness is okay, the waste management okay, so they're good.
So what will you be doing from here? What is the next step?
Apart from the fact that I'm saying they're good, we're also, from the tool, we'll score them. We're going to have it on record that from the last visit, this was the scoring. So next time we'll come, we'll just do a comparison. If they have actually improved, or if they would need more engagement in terms of telling them what they need to do and showing them what they need to do.
Okay, I can see that they have to register with HEFAMAA yearly.
Yes, the renewal of registration is yearly.
So how many of these hospitals have you got into your net?
We have over 3,860 health facilities, but it's not only hospitals. Hospitals in that proportion is like 1/3. We have about 1,150 hospitals like this in Lagos that are registered. And for us to ensure that these hospitals continue to comply with the set standards, we go out every day. We visit facilities on a daily basis. Yeah. We have 4 teams comprising mostly of doctor or a nurse and a recorder, but sometimes a nurse or 2 nurses and a recorder. But we go out every day to visit health facilities. Each of these teams have areas that they are covering.
So how does HEFAMAA sanctions in hospitals?
Okay, so 1, you have to register. Yes, if you are not registered, according to the health sector reform law of 2006, section 60 says that any health facility in Lagos, before you establish, you must register. So that is number 1. If you are not registered, you are liable to be closed because it's an illegal health facility. Then you must also have qualified staff. A hospital that does not, or a facility that does not have qualified staff is not a facility, it's not a health facility. So facilities like that, we actually close them down.
The agency also has online platform named HEFAMAA, which enables owners of hospitals to register their facilities before officials pay unannounced visits to physically inspect them.
If you want to register a health facility in Lagos, you must go online, fulfill all the documentation for registration. Then at the back end, our staff sees your intention, and then we visit to inspect for compliance.
All these to ensure that standards are strictly maintained in provision of quality health services to residents of Lagos State.
I can see your efforts really, but despite that, people still patronize unregistered facilities. What is your advice for them?
Okay, so I would advise, if you go to any health facility that does not have a HEFAMAA logo, then don't patronize that health facility. If you go into that health facility and you do not see a copy of the certificate of registration from HEFAMAA to that facility, then don't patronize that health facility, because it means that that is not a health facility that is recognized by government to give quality health care to the citizens of Lagos State.
Then lastly, I would like to know how HEFAMAA is keen into Governor Babajide Sanwo-Olu's THIMS agenda, which is the second pillar of his THIMS agenda, really, health and environment. Tell me more about it.
Okay, all right. So, it's paramount that if you're going to give healthcare services, it has to be of good quality. So we ensure that all health facilities in the state are providing quality care to the citizens of Lagos State. And the governor is also keen on mitigating the cost of healthcare services. So he's interested in the health insurance scheme, and we collaborate with the Lagos State Health Scheme by assessing facilities that will go on that scheme. So that's how we fit in. By improving the quality of healthcare. Yes, we want to ensure that every person in Lagos State has access to quality healthcare, regardless of the place where you access that care, either a public or a private health. Every facility we visit, we score with the 2. So if you pass, the pass mark is 70%. If you pass, we send your name to Lashma, and then they go further and engage with the health facility.
Well done. Dr. Abiola Udo, thank you so much for coming on Inside Lagos. I appreciate you. Many thanks. Regulation and monitoring are key to quality service delivery in the society. So regulatory agencies like HEFAMAA and service providers must strive for the best global practices at all times. And that's all we have for you on this week's episode of Inside Lagos. Many thanks for being a part of it. I'm Adedoja. Salam Adeni.